Our residents spend a considerable amount of time throughout all 3 years of their residency training at Taub Hospital. Taub Hospital is one of 2 Level 1 trauma centers in Harris County, servicing more than 4 million residents that live in Harris County, as well as 18 contiguous counties that may refer patients for a higher level of care for emergency services. Our clinic receives referrals through our 4 outlying community health centers, which are staffed by primary optometrists and comprehensive ophthalmologists. Thus, all patients that are being referred to Taub are those that are seeking subspecialty services, procedures, and surgery. And all of our procedures and surgeries are staffed by fellowship-trained specialists, and all of our clinics are trained by Baylor faculty as well.
We are very proud of the resources and technology we have available for our residents to care for our underserved Harris County patients. Our current Taub Eye Clinic opened in 2016 and has 15 eye lanes outfitted with Haag Strite slit lamps. Many people assume that county facilities may not have access to state-of-the-art equipment, but here at Taub we have an impressive array of diagnostic devices, including Heidelberg OCT, Optos, wide field angiography, Humphrey visual field machines, as well as up-to-date IOL master and topography. In addition to examining patients, we perform a large number of procedures in clinic. To facilitate this, we have a dedicated minor procedure room with a Zeiss Lumera microscope. In addition, we have an LX Trio for our glaucoma lasers and YAG capsulotomies, as well as a Luminous Varia for our retina laser needs.
During our rotations at Taub, we care for patients with the most need in Harris County. Our patients come from all over the world and have a diverse range of pathology. It's truly incredible and humbling what we see in the clinic and while on call. Sometimes we'll make a diagnosis that we may only see once in our career. The running joke is that there's never a normal day at Taub. Our clinic is completely resident-run and rotates through subspecialties on different half-days. We've assigned faculty preceptors for each subspecialty available at all times. Some of these educators are the best I've ever had and who really work hard on supporting our training. Furthermore, the Taub Clinic is also simply a nice place to work. Our new clinic is bright and welcoming. The residents also have a great relationship with our technicians and nurses. The Taub experience is really a highlight of our training at Baylor Ophthalmology.
Our Taub team consists of 5 full-time residents, 2 PGY2, 1 PGY3, and 2 PGY4 residents, who are joined by other residents throughout the week periodically that are on their subspecialty rotations, such as oculoplastics, neuro-ophthalmology, retina, and cornea. The PGY2 level resident not only sees patients in the clinic, but also starts their surgical experience. They are primary surgeon for ophthalmic plastics procedures in the operating room, as well as performing laser procedures in the clinic. They will perform panretinal photocoagulation, YAG capsulotomy, and laser trabeculoplasty. They also start their surgical experience in cataract surgery by performing portions of the surgery during the first half of the year, culminating in primary surgeon for cataract surgery in the second half of the PGY2 year. The PGY3 resident primarily covers inpatient and emergency room consultations. During this year, they also expand their surgical experience by performing additional cataract surgery and assuming the role of primary surgeon in vitrectomies and other retina cases. As a PGY4, our residents continue their growth as ophthalmic surgeons. At Taub, they function as primary surgeons for cases involving all subspecialties. They will do complex cataract surgery, secondary intraocular lens placement, as well as doing glaucoma surgeries, such as trabeculectomies, glaucoma tube shunts, and MIGS. In addition, they continue to do more vitrectomies and a whole host of oculoplastics procedures, from blepharoplasty, temporal artery biopsies, enucleations, to complex orbital reconstruction.
Our state-of-the-art equipment is not just limited to the clinic. Our primary operating room has a brand new ceiling-mounted Zeiss Lumera microscope that was just installed in the summer of 2020. For cataract surgery, we have the Alcon Centurion phaco machine, as well as an impressive IOL consignment. We have monofocal lenses from the 3 major IOL companies, as well as access to toric and presbyopia-correcting lenses. For our glaucoma patients, we have the latest FDA-approved MIGS devices, including Zen, iStent Inject, Hydrus, KDB, and the Omni. For retina, we have the Alcon Constellation vitrectomy machine, as well as the ReSight viewing system. And most importantly, because we do so many cases, our OR staff are familiar with and trained to handle eye surgery.
I think one of the biggest strengths of this program is our OR experience at Taub, where we serve as a primary surgeon for various cornea, glaucoma, oculoplastic, and retina cases. We treat patients with extremely complex and end-stage ocular pathology. The amazing thing is that we get to perform these procedures start to finish while learning from world-renowned faculty. The Taub rotation allows you to leave Baylor confident in your surgical skills. I don't think any program in the country prepares you for difficult cases as well as this program. And because I am the primary surgeon, I'm able to follow all my patients closely during their pre-op and post-op care. That's not only good training, but it's also a very rewarding experience.
The breadth of pathology and the broad clinical and surgical experience at Ben Taub prepare our residents well for whatever career path they choose to pursue. Caring for the underserved is a very rewarding experience, and our residents play an integral role in fulfilling the mission of Harris Health and caring for those most in need in the greater Houston area.